In every pregnant woman, the baby in your womb is covered by a sac called amniotic sac. Within that sac is contained a fluid called amniotic fluid. Now, this amniotic fluid has a lot of physiological functions. Number one is that it serves as a shock absorber, cushion effect, protecting the baby from trauma. It serves as a medium of removal of waste product. Now, it also helps for the development of the baby's lungs. It has some immunological functions, protecting the baby from infections. It also helps with the regulation of the temperature of the baby, with some other benefits. Some conditions can make the fluid to reduce, abnormal reduction in the amniotic fluid, and this is called Oligohydramnios. When the amniotic fluid is in excess, it is called Polyhydramnios or Hydramnios. Some conditions, the fluid will be absent completely, and it is called anhydramios. Now, in today's video, we want to understand what are the possible causes of oligohydramnios. What are those conditions that can make that fluid, the amniotic fluid, to reduce? So if you enjoy this kind of video, please subscribe to this channel, like this video, drop a question in the comment section, and send the video to at least 10 of your friends. Now, number one thing that can cause reduction in the amniotic fluid is reduced fetal urination. That is reduction in the urine produced or secreted by the baby into the amniotic sac. The reason is because the urine of the baby gives a major contribution to the amniotic fluid. Okay, so anything that can reduce the production of urine by the baby or obstruct the passage of urine by the baby will cause reduction in the amniotic fluid. In a condition where the baby's kidneys are completely absent, both kidneys, there will be no urine production, and this condition is called bilateral renal agenesis. In this condition, there is no kidneys, therefore no urine production, and that will drastically reduce the volume of the amniotic fluid. Another condition that can cause reduced urine production is bilateral multicystic dysplastic kidney. In this condition, both kidneys are present, but they have a condition called multicystic dysplastic kidney. These kidneys are filled with cysts. Cysts are like balloon containing fluid or nylon containing fluid. Now, these things, when they are in the kidney, they will disrupt the functionality of the kidney. Okay, so the kidneys cannot function appropriately. Therefore, there is reduced urine production. In a condition where you have absence of one kidney and the kidney that is present will have multicystic dysplastic kidney condition, it will also reduce urine production. This condition is called unilateral renal agenesis and contralateral multicystic dysplastic kidney. So one kidney is completely absent, but the other one that is present has the condition called multicystic dysplastic kidney. Because of the multiple cysts in that one that is present, its function is drastically reduced, therefore reduced urine production from that one kidney in the absence of the other kidney. So the urine production in that condition is also very drastically reduced. Now, some conditions can cause obstruction of the passage of the urine. So in this condition, there is kidney or both kidneys are present and there is urine production, but there is obstruction in the passage of the urine. Okay, one of them is called posterior urethral valve. In this condition, there is obstruction in the urethra. There may be urethral stenosis, that is narrowing of the urethra of the fetus. This can as well reduce the passage of urine. And then there is urethral atresia. So these three conditions can reduce the passage of urine from the kidneys into the amniotic sac, and this will reduce the content of the sac, which is the amniotic fluid. Number two major cause of reduced amniotic fluid, that is oligohydramnios, is reduced blood supply to the placenta. This is called decreased placenta perfusion. In this condition, there is no enough blood going to the placenta from the mother, and that means there is reduced blood supply to the baby. And remember, the blood that goes to the baby is what is being supplied to the kidneys for ultrafiltration that will eventually give out urine. Okay, so when there is reduced blood supply to the baby, there will be definitely a reduced urine production. So some conditions in the mother that can reduce blood supply to the placenta include chronic hypertension. This is a condition where the mother already has hypertension, high blood pressure, before getting pregnant. And if this high blood pressure is not being controlled, it will reduce or constrict or narrow the blood vessels supplying blood to the uterus and the placenta, and this will reduce the amount of blood going to the baby. And that further reduce the amount of blood going to the baby's kidneys for urine production. There is a condition called abruptio placenta. In this condition, the placenta is separating from its attachment to the wall of the uterus, therefore disconnecting the vessels, that's the blood vessels, the arteries supplying blood to the placenta from the uterus. This will further reduce the amount of blood going to the baby for ultrafiltration in the kidneys. Another condition that can reduce the blood supply to the placenta is maternal anemia. This is a condition where the mother's blood is reduced. The mother's own PCV, packed cell volume, is reduced. Therefore, the body will channel the remaining amount of blood in the mother to the mother's brain and the heart. This is called head sparing, trying to give blood to the most vital organs in the mother's body. Therefore, the amount of blood being supplied to other organs like the skin and the kidney and the uterus and the rest will reduce. In this condition, the amount of blood going to the fetus will reduce, and that will reduce the urine production by the baby. Number 3 major cause of oligohydramnios is rupture of membrane. Remember I said when you are pregnant, there is a sac covering the baby which is called the amniotic sac. That sac is also called the fetal membrane. Now, if there is a tear or a cut on that membrane, the amniotic fluid contained by that sac will start leaking, and this is called rupture of membrane. Now, you can know if you have this by having a leakage of fluid from the VG. Okay, so if you experience this, please see your doctor for confirmation. Number 4 major cause of oligohydramnios is fetal growth restriction, intrauterine growth restriction. This is a condition where the baby is not growing as expected, and there are so many things that can cause this, from the genetics, from the mother's contribution, from the fetal factors and combined factors. Okay, so when this happens, the amount of blood going to the baby will also be small, and the size of the kidneys will be small, so the appropriate volume of urine production will not be there to supply the amniotic fluid. Number 5 major cause of oligohydramnios is preeclampsia. Okay, preeclampsia is a condition in pregnancy that happens when there is high blood pressure developing in pregnancy from the 20th week of that pregnancy as a result of the pregnancy. What I'm trying to say is the woman before getting pregnant and during that pregnancy before 20th week does not have high blood pressure, so it is pregnancy induced hypertension. Okay, plus the presence of protein in the urine. This is proteinuria. When a woman has this condition, preeclampsia, the underlying cause, the underlying pathology is failure of the remodelization or changes, necessary changes in the artery that supplies the uterus has failed to happen. Okay, and this happens when there is failure of the invasion of the trophoblastic tissue. Please don't get offended by the grammar. What happened is there is an artery called spiral artery that supplies the uterus. Now, during pregnancy, this artery should be remodelized, should change some necessary changes in the artery, which includes reduction in the resistance in that artery so that there will be free movement of blood, increase in the capacity of the artery so that it can contain more blood, and reduction in the thickness of the wall of the artery so that the artery might resemble more like a vein. Okay, now when these changes occur, it helps to increase blood flow from the artery to the uterus and to the placenta. But when this fails to happen, that artery will become resistant, and it will have thick walls, and it will also have reduced capacitance. That's the volume. The space in the artery will still be small, so this will reduce the amount of blood flowing through that artery to the uterus and to the placenta. And when this happens, it will cause preeclampsia. Now there is reduced blood, and therefore there is reduced blood going to the baby and to the baby's kidneys for urine production, and this will cause oligohydramnios. Number 6 major cause of oligohydramnios is vascular diseases in the mother, a condition where there is problem with the artery of the mother. Example is atherosclerosis, where there is an atheroma, something like a plaque on the mother's blood vessel, and this will be narrowing the lumen or the passageway within that artery. And if this happens, it will reduce the blood flow from that artery. Therefore, this will reduce the amount of blood going to the fetus and therefore reduce urine production. Some drugs can cause oligohydramnios. Example include ACE inhibitors, the ARBs, and the NSAIDs. ACE is angiotensin converting enzyme inhibitors. Okay, ARBs are angiotensin receptor blockers. NSAIDs are non-steroidal anti-inflammatory drugs. Now, the ACE inhibitors, these are drugs that inhibit the enzyme called angiotensin converting enzyme, ACE. Now, this enzyme converts angiotensin 1 to angiotensin 2. Angiotensin 2 is a vasoconstrictor. Now, when this happens, this enzyme is not being converted to the active enzyme, which is angiotensin 2. Therefore, there is reduced vasoconstriction effect in the vessels. Okay, then the ARBs are angiotensin receptor blockers. In this condition, the angiotensin 2 is produced, which is a vasoconstrictor known to narrow blood vessels. But this drug called ARBs, angiotensin receptor blockers, will stop the effect of the angiotensin 2. So both the ACE inhibitors and the ARBs will cause hypotension, okay, and resultant renal hypoperfusion, that is reduced blood supply to the kidneys of the baby. Examples of the ACE inhibitors include lisinopril, captopril, enalapril, and others. Examples of the ARBs include losartan, candesartan, temesartan, and others. So these drugs are contraindicated in pregnancy. They are not used in a pregnant woman for this reason. So if you are pregnant, make sure you get all your prescribed medications from your doctor. Now, the NSAIDs, non-steroidal anti-inflammatory drugs, these medications are used to treat inflammation and to stop pain in some conditions. Okay, so examples include the aspirin, diclofenac, ibuprofen, and others. Now, from researches, these drugs have been shown to cause narrowing of a vessel called ductus arteriosus. Now, this particular blood vessel, an artery, is a connection between the fetal aorta and the pulmonary artery. Now, the pulmonary artery is carrying blood from the right ventricle to the lungs for oxygenation. But in a baby, in the fetus, there is no oxygen in the lungs because the lungs are not functioning at that moment. The lungs are filled with fluid. So the lungs doesn't have any function for oxygenation of blood. And the blood coming to the baby is also an oxygenated blood from the mother. So this artery is connecting the pulmonary artery so that it can channel the blood from that artery to the aorta, which will carry the blood to the head and other parts of the baby's, of the fetal body. So when this artery, the ductus arteriosus, is narrowed as a result of usage of NSAIDs during pregnancy, it will reduce the amount of blood being channeled from that pulmonary artery to the aorta, therefore reducing the amount of blood being circulated to every other part of the baby, including the baby's kidneys, therefore reducing the amount of urine production by the kidneys. So NSAIDs are also contraindicated in pregnancy. Another major cause of oligohydramnios is postterm pregnancy. when a pregnancy reaches 42 weeks, that is post-term pregnancy, okay, and that can cause reduction in the amniotic fluid. Now, from researches, the amniotic fluid tend to start reducing from 38 weeks of the pregnancy, but this is a normal physiologic reduction in the amniotic fluid. But from 40 weeks, the amniotic fluid will tend to reduce by 8% every particular week after 40 weeks. Why does this reduction happen? It is because of the aging of the placenta. The placenta is becoming old, and therefore there is higher deposition of the calcium in the placenta. This is called placental calcification. There is a certain amount of placental calcification that is normal, that is physiologic, that has no problem. But when the pregnancy starts becoming post-term, that is from 42 weeks and above, the placental calcification becomes higher than normal, and that will cause reduction in the passage of blood vessels, nutrients and oxygen from that placenta, reducing the amount of blood going to the baby's kidneys for ultrafiltration, and that will reduce urine production. So when your pregnancy gets to 40 weeks, 41 weeks without labor signs, please go to the hospital and see your doctor. The last condition that can cause oligohydramnios is dehydration, maternal dehydration. When a pregnant woman becomes dehydrated, the osmolality of her own fluid compartment will increase. Usually, the maternal fluid compartment and the fetal fluid compartment and that of the amniotic fluid have different osmolalities. That of the mother is around 280 milliosmol per liter, and the fetal fluid and that of the amniotic sac is about 260 milliosmol per liter. But when the pregnant woman becomes dehydrated, this 280 milliosmol per liter will increase and become higher. And because of this increase in the osmolality, it can drag fluid from the fetal component into the maternal component. Therefore, the fetus will now drag more fluid from the amniotic fluid into its own component. Okay, this will further reduce the amount of amniotic fluid. I hope this makes sense. So these are the possible major causes of abnormally reduced amniotic fluid, a condition called oligohydramnios. If you got value from this video, please subscribe to this channel, send this video to at least 10 of your friends, drop your question in the comment section, and I shall see you in the next one.